Thank you for coming and spending a little bit of time with us today. I know today has been a very busy day for most of you, so I appreciate that you're here, that you're still engaged, that you're still learning. So we're thrilled to have you here, and we're going to do our very best today to see if we can stump you. So officially welcome to our Guess Who panel hosted by Health Professions Week. My name is Mandy Now, and I'm the Executive Director of Health Professions Week. And I'd like to start by saying thank you to our panelists today, each of whom you'll have a chance to meet after they've done their very best to stump you today. Here's how the game is going to work. I am going to give each of our panelists a chance to introduce themselves to you. Each is going to have 1 minute to describe what they do on a daily basis without revealing their profession to you. Take good notes and make your predictions of which profession each panelist represents. You can also start posting your questions in the chat so that after our reveal, we can answer some questions that you have either about their profession or about being a health professional in general. When we're finished, I'll have them reveal who they really are, and we're even going to start with a hint. I'll share with you which of the health professions they represent. Okay, so can you guess who? Let's start with Amy.
Hi, my name is Amy Wiggins, and I come to you from the wonderful state of Massachusetts. I just got off a pretty long shift. So I'm a little frazzled right now. So I'm going to try to do this without telling you what I do. I am a certified licensed healthcare provider. I provide preventative care, emergency procedures, and rehab of various medical conditions. My profession works in numerous different settings. We work as a team with other medical care providers. It's fun, it's fast-paced, and we are qualified, skilled healthcare professionals.
That was fantastic. Thank you. Okay, I'm going to have Anthony go next. Anthony, can you stump us today?
We'll try. I am Anthony Pannaza. I'm coming from Arizona. And in my profession, I also work with people recovering from injuries. Varying forms of chronic pain as well. And I work with other practitioners. Team-based approach works best. And I usually see these people for 8 to 10 times for their treatment. And then 3 to 6 months out, we follow up again.
That was really good. Okay, Jake, I'm going to have you go next. Can you stump us today?
I'll try. Hi, everyone. My name is Jake Wines. I'm from Maryland. I work out of a university-based practice. I treat patients. I work in a collaborative setting as well, much like everyone else. I take call. I work at a hospital. I see patients. I treat conditions that cause people pain. Sometimes they come into my office with the pain. Sometimes I get called from the hospital to see the patients that have problems. I'm in a very fruitful career path where there's plenty of opportunity to do a wide range of things, from conservative management and even sometimes will operate.
Fantastic. Okay, and Liz, you are our last Guess Who panelist. Can you stump them today?
Thanks, Mandy. So hi, everyone. I'm Liz. I'm from Wisconsin, and my profession is found in a variety of environments. We bring a specific expertise, excuse me, to the healthcare team. For me personally, I work in the inpatient environment quite a bit, and we work hard to ensure that various types of treatments are safe and efficacious, and at times can be optimized for patients. My profession can either be a more generalist model, or you can pursue very specialized areas of medicine.
Ooh, Ooh, those are all so good. Oh my gosh. Okay. So I was trying to see, does everybody have access to their reaction emojis, or do we just want to do this in the chat? I'm going to ask it this way. Who thinks Anthony, give us a little wave so they can remember who you are. Okay, so who thinks Anthony might be a pharmacist? Can you either give me a thumbs up in your panel or put it in your chat if you think Anthony is a pharmacist? I'm not seeing anybody say Anthony is a pharmacist. How about Anthony is an athletic trainer? Not seeing that. Anybody want to give a guess in the chat who they think Anthony might be? Is Anthony a naturopathic physician? Is he a podiatric physician? Anybody want to put any guesses in the chat? All right, and what about, okay, so we have one vote for Anthony as an athletic trainer. That is an excellent, excellent vote. Who wants to vote for Amy is a pharmacist? Or Amy is an athletic trainer? Amy is a podiatric physician, or Amy is a naturopathic physician? Do we have any guesses? Jana also thinks that Amy is a naturopathic physician. Okay. What about Jake? Who thinks Jake might be the pharmacist in our poll? And what about Jake as an athletic trainer? Jake is a podiatric physician. Jake is, somebody votes for, Yishin thinks Jake is a DPM. And what about Jake is a naturopathic physician? Do we have anybody who thinks Jake is our ND? Okay, so then we'll go through Liz. Is Liz our pharmacist? Is Liz our athletic trainer? Who thinks Liz might be our podiatrist? Jana, is that your vote for, okay, so we've got 2 votes that Liz is our PharmD, okay. And Liz, last chance to vote. Voting is going to close very soon. Is Liz our naturopathic physician? Anybody want to say that they think Liz is our naturopathic physician? Okay, do you guys have your signs ready? On the count of 3, I'm going to have everybody hold their signs up so that you guys can see who was right. All right, 3, 2, 1, go.
Oh, I got to change my background. Let's you guys can see that.
Well, for those of you that can't see, Dr. Wiggins is our podiatric physician. So good job, you guys. This is great. You guys did an amazing job trying to stump our audience today. And I think you may have done it this time. Now that we know who you really are, now I'd really like for you guys to take a couple of minutes to describe the key highlights about your profession. What makes your profession unique? And Dr. Wiggins, we're gonna, just because of where you are in my Brady Bunch, I'm gonna start with you and give you a couple of minutes just to chat a little bit about why you are a podiatric physician.
Great, Mandy. Thank you so much. And I apologize, I'm in a little bit of a time crunch. So I chose this field more just because it found me. I was not necessarily drawn to foot and ankle, but certainly I wanted to be a healthcare provider. I got my roots early on by doing some basic science research while I was an undergraduate, actually within urology out of all things. And I could have sworn I was going to be a urologist when I grew up, but certainly through experiences, both with family members that have gone to podiatric physicians and just seeing that it's a profession that does allow you to have the option to pursue both medicine and surgical aspects of foot and ankle care kind of drew me to that. I still had to go through undergrad. I actually went to graduate school in between. I ended up doing 4 years of podiatric medical school. It's 2 years of didactics, 2 years of clinical clerkships, and then it's a residency that I did for 4 years and a 1-year fellowship thereafter. So there's certainly sky's the limit with this type of profession. You could certainly have a type of career path where you're primarily private practice and you do predominantly outpatient things. You could work out of a surgery center doing reconstructive foot and ankle surgery. You could do inpatient work, which is kind of the way that my practice is run. I would say it's about 50% inpatient, 50% outpatient. It's great. I have a background in deformity correction and limb lengthening. I treat everything from pediatrics, newborns with club feet to the elderly. are now becoming more and more active. It would not be uncommon for me to do a major surgical reconstruction on a 78-year-old or something like that. So it's pretty remarkable at all stages. But because you do operate and you do surgery, I also prescribe medicine. And with that, there comes a responsibility, and that responsibility lies in the fact that our training has to be such that we are prepared to do all the perioperative management for these individuals as well. I am a assistant professor at the University of Maryland. I have a faculty appointment at the School of Medicine. I'm a fellowship director in limb preservation, deformity correction. I'm the co-director of the limb preservation and deformity limb preservation program at the University of Maryland, which is kind of cool. It's a multidisciplinary program where we take patients from all over, sometimes even out of state, that have limb-threatening wounds with vascular complications, and with a team approach with myself, my vascular surgery team, my plastic surgeons, we reconstruct limbs, we save limbs, and there really is a big component of my practice doing the limb salvage stuff. So that's part of it. And like I said, I just love the reconstructive aspects. I love that it's multifactorial. Certain colleagues of mine and friends, they have career paths where, they work, roughly 5 days a week, maybe do about a day a week of surgery. My days are predominantly operating Mondays and Wednesdays and Friday afternoons, and seeing patients Tuesday, Thursday, and Friday. And again, it's multifaceted. I think that it's, again, a profession that sort of found me, and I'm very fortunate to have found it. And I think that there's a great opportunity to kind of take it whatever direction you choose, but just know that it's not necessarily any less of responsibility in managing these patients, because you do have to understand what's going on with the patient from head to toe, and not just treat just the foot and ankle.
Wonderful. Thank you, Dr. Wines. That was very eloquent description of the profession. Dr. Elizabeth Laubach, do you want to tell us a little bit about your role as a pharmacist?
Sure. So I like to say I took the long and winding road to pharmacy. I finished my undergrad degree and did not know what I wanted to do with my life, but liked the idea of medicine, and just had to kind of figure out where I fit in. So my start in the healthcare field actually came as an EMT. And through that, kind of found that I was more of an analytical mind, and really was sort of fascinated by the pharmacology of medications. And then when I explored the field and got some time in it, shadowing, I was really impressed at how many different ways you could go within pharmacy. And I really liked that, because especially as somebody who didn't quite know where I fit in, I liked the idea that I could go different places. I then went on to get my PharmD degree, or Doctor of Pharmacy, at Concordia University of Wisconsin, which is also now where I just started a new job as an assistant professor there. But in my time as a pharmacist, I have worked in what you might think of as the more traditional model in the community at a retail store. I have worked in the inpatient environment, in a more generalist model where we handled really all areas of the hospital. And now I'm in my, we'll say, clinical area of expertise, which is toxicology. So I predominantly work with poisonings, overdoses. I've worked for poison control in the past. And so now that's my specialty area, and also what I'm teaching. But what's really wonderful to me about my profession is no matter where you are, no matter what environment you work in, whether it's community, ambulatory, long-term care, inpatient, you're the drug expert. And so you're part of this healthcare team, but you bring this specific expertise. And then if there's an area you want to pursue, you can do that. I have colleagues who specialize in oncology, cardiology, infectious disease, HIV, it goes on and on and on. And then if there's an area that you find particularly interesting, and maybe there's not a board certification associated with it, usually there's opportunities for that as well. A good example in my case, I really enjoy emergency preparedness, emergency management. So I do some work with the state of Wisconsin when it comes to public health and emergency preparedness. Obviously with COVID-19, pharmacy is a big piece of the response there too, as everyone else here on this meeting is, but for me, it's what I find so passionate is that you talk to patients, you collaborate with other members of the team, and then you can bring your expertise to whatever environment you're in or whatever clinical specialty you're in. So lots of options, and I've enjoyed all areas that I've worked in as a pharmacist.
Wonderful. Thank you. Thank you for sharing. Ms. Amy Wiggins, can you tell us about your role as an athletic trainer?
I sure can. Hi, everyone. I work in Massachusetts. I'm an athletic trainer at Phillips Academy Prep School. I started my career years ago, always working in the secondary school setting. When I started, I found quite a need for healthcare to be provided in the high school setting. So I took it to a whole new level. So when I first started, some schools had athletic training coverage. Usually one athletic trainer was around. The profession mandated a bachelor's degree. Now we require a master's degree. You can take that on and get your PhD if you would like to. And from that, I ended up in the private school sector, and we designed a healthcare team. And I would like to describe what our team looks like at Phillips Academy. We have one orthopedic doctor. We have two doctors, and one is the medical director. She's my supervisor. We have 4 full-time athletic trainers. We have 4 nurse practitioners, 4 physician's assistants, 14 nurses, 10 counselors, and 1 nutritionist. We all work out of the wellness center, and we all bring each unique expertise that we have to the table, and we try to provide our athletes and students with the best healthcare that we can. What I do is I work primarily in our concussion program. I also work as the president of our sports medicine advisory committee to all New England prep schools. And I work for the National Athletic Trainers Association in the secondary school athletic training department, where we try to provide coverage in working with the Corey Stringer Institute of UConn throughout all New England states. And we're making progress. We have a long way to go. I absolutely love my job. I'm a little tired. We had quite a big day today. It's also a little bit later here in Massachusetts. I will say we had a very busy day of injuries. And I think what I really enjoy the most about what I do is when I'm with the athletes and they are injured, how we put this team together and get them back on the playing field. Sadly, I report we had 2 ACL tears in our women's soccer game today. But I know that we're going to give them great care, and I know I'll also be on the sideline when we get them back on the field, which is what I enjoy the absolute most in what I do, is bringing those athletes back. I'm a mom of 4 daughters. All of them were athletes too. Within my own house, we had 4 ACLs, so I'm pretty familiar with that particular injury. But if you enjoy sports and you enjoy healthcare and you enjoy medical care, it's a great field to get into.
Wonderful. Thank you. And last but not least, Dr. Anthony Pannaza, tell us a little bit about naturopathic medicine. Did I cut out a little bit? Dr. Pannaza, go ahead. Yep.
Yep, you're good. You're good. No, so I'm a naturopathic physician here in Phoenix, Arizona. I actually work at the college, so Southwest College of Naturopathic Medicine, and I end up teaching physical medicine, which is osseous manipulation. Very similar to kind of chiropractic medicine is what most people equate it to. It's slightly different, but I've kind of put myself in traumatic recovery. So I love injuries, people recovering from injuries, and traumatic brain injuries are very much my favorite patients to get back on board. But I have to say, my biggest thing that I love about naturopathic medicine is I get to use several modalities, and I get to work with several different doctors, whether they be surgeons, whether they be cardiologists. I get to work with the whole gamut, and it's really great. Some of my favorite modalities are going to be, of course, the osseous manipulations, popping bones. But I also get to use a lot of physiotherapy modalities like e-stim and things like that. But acupuncture, and I also get to use botanical medicine. I have a very large toolbox that I get to use. And those do include medications. I know naturopaths, sometimes the thought is that we don't use medications, but there are times and places. So I love that I get to kind of incorporate all of it and work with a healthcare team that really does allow us to all work together because we all have something that we can provide for the patient.
Wonderful, thank you. And Yushin, I know that you said we don't have any questions in the panel, so I just want to make sure that if you are in our audience and you want to put a question in the chat, or if you want to turn your
I'm sorry. I think Dr. Mandy just freezed, but I'll continue. I think if you have any questions or attendees, feel free to type your question in to our chat, and then our panelists will love to answer your questions. So.
And then if there are no other follow-up questions, I have one for the panel, and anybody is welcome to chime in. If you were going to make a recommendation for an extracurricular activities that students who are interested in pursuing your career could do that would help them to understand your profession, what would you recommend?
I'll start very quickly. I think just shadowing. I think that's the best thing you can do. Honestly, it's finding a provider that's local to you, that is willing to accept you. And certainly I'm one of those people. So if anyone's from the Baltimore area and they want to come spend a day and kind of see what I do, I'd be more than happy to have them. I think that there's nothing better than just seeing it for yourself. And quite honestly, that's what got me is, the pamphlets only do so much, to be honest with you.
Yeah, I would also say shadow, especially in pharmacy. I encourage prospective students and help them network to shadow in more than one area because there are pharmacists that are very particular to certain, we'll say, locations within the health system. So I try to get you, try to get more than one location. The other thing too right now, there's a huge need for pharmacy technicians in many areas of the country. You can start as a pharmacy tech with your high school degree and no additional training. So if it is something that really interests you and you also are trying to work while you're going through school, there's lots of exposure that way as well.
Wonderful. Well, thank you so much, you guys. I am going to go ahead and say that that's all the time that we have for today. And I want to thank everyone for playing Guess Who with us today. And I'm hoping that we stumped you and maybe that you learned a little something that you hadn't yet considered. I do want to thank each of our panelists for being here today. If you have any follow-up questions for the panel, you are absolutely welcome to email us at healthprofessionsweek@gmail.com, and we'll be more than happy to connect you to these professionals or staff who are able to answer more questions for you about careers in the health professions. And I want to encourage you to keep exploring. Here at Health Professions Week, we have lots of resources to help you explore careers confidently. Learn more and register for our next event at explorehealthcareers.org/HPW, and you can grab the QR code as well if that's easier for you just to snap it with your phone. Health Professions Week is November 4th through 11th, so a few weeks from right now. It's a great chance for you to come back and get more of your answers to your questions. And so we have lots of live panel events like this one and on-demand career games and videos. So we hope to see you at Health Professions Week, and I will drop that link into the chat. And again, this is kind of our last call for any questions or comments.
I actually have a question. So I'm wondering how, like, since we're going through the pandemic, how has the pandemic changes the work in your specialty? How does that affect you, or this specific job or the public health?
I mean, from my perspective, there's a global national nursing shortage at this time. Some of it is specifically vaccine mandate issues that have been ongoing. Generally, we are short on hospital beds. There are short OR staff. so it's actually nothing positive. The hurdles that are also required to get a patient to the hospital, treated in ER, and also, I mean, not that ERs are overrun specifically, and I can only speak for Baltimore, Maryland, and University of Maryland specifically, but generally speaking, I think that it's really taken its toll, I think mostly both physically, psychologically, and physically on the entire health system is just kind of an understatement. So that's kind of my sort of roundabout way of just saying that I pray that things get better and that we can continue providing good patient care, because we're really working out of the box in a lot of instances, and it just seems to change daily.
Thank you.
I would agree with you, of course. I think from my profession, it halted a lot of what we do. And for me personally, I found the opportunity to continue to work. Lucky that my place of employment kept me employed through this, but also we picked up other roles within our community. We were testing at our local hospital. We, as athletic trainers, started to reach out to the healthcare profession and see where we could fit in and where we could help and what we could do to assist. I agree. It's a very frustrating time. I hope this ends very soon, but I did see opportunity to share some of what we do with others and help them through this. A very challenging time, for sure.
Thank you. Sorry.
I definitely, oh, no, you're good. I definitely agree with everything. It's been a challenge. No, for me specifically, I definitely need my patients to be in person for me to do what I do. So just like Amy was saying, it was a downturn in patients, and it's been hard to get them back kind of with the whole pandemic. But I can say for a lot of my colleagues, we actually saw an uptick in people trying to like jump into a little preventative health, trying to, be healthier so that they weren't getting exposed. So we actually branched into the virtual medicine a lot over the past year and a half. And we actually saw more people trying to, be ready if they did get sick, or find out if they do have some predisposing factors. So a lot of my general medicine colleagues were seeing more patients, and it's for good. It was for their health. But yes, for me specifically, I did see a downturn in patients, and it's coming back.
So on the pharmacy end, the word that always comes to mind for me when I talk about pandemic response is adaptability. And so that can be day to day, knowing that, hey, today we've got to vaccinate a couple hundred people and someone needs to drop those doses or actually be the person vaccinating. It can be related to drug shortages, knowing that we had something yesterday and we don't today because it's being used quickly. Or it's more limited resources like emergency use authorization drugs, where you only have so much today, you might have more tomorrow, but you don't know. And then on top of it, kind of speaking to what everyone else on the panel has said, we have, seen the strain on our resources. So when you're part of a bigger health system, knowing that, hey, today I might take on these additional responsibilities to help free up this other site. And also too, for us, definitely more telehealth and virtual. But the word that always sums it up for me is adaptability.
Thank you, our panelists, for answering. I actually have one more question if we have the time.
Sure.
So I'm just wondering, what is a day in your career like? Like, how does it work? How does it flow? Like when you go into your office or go into your pharmacist, how does it look like?
I'll just start, I guess. Sorry, just seems like I've been the one that's been going first. I apologize. I just jumped in on it. But yeah, so day to day, like on a Monday, I try to do about 4 to 5 surgeries, some of which are scheduled and some of which are what we call add-ons for hospital emergencies. Tuesdays, I work at the wound center where I see chronic wounds of patients that have holes in feet and ankles. So I try to get those holes in feet and ankles healed up. Sometimes just by putting things on them, you have to clean them. You got to do what's called debriding, which means removing all dead or infected stuff. And usually say it's not what you put on the wound, it's what you take off. So these patients need a lot of care. I happen to be a type 1 diabetic, just got diagnosed. So fortunately, I don't have neuropathy, but definitely runs more rampant in patients that have neuropathy, which is the absence of sensation. So yeah, certainly it's kind of sobering, but at the same time, so Tuesdays I treat patients at the wound center. Wednesdays are my surgery day, but sometimes I'll run back and forth and see some patients in clinic as well. I'm fortunate to have one of my office settings at the hospital, so I can run from the operating room back down, see some patients, run back up. Thursdays, I see about 40 to 50 patients. And then Friday mornings, I'll see between 35 and 40, and then I'll operate in the afternoon. And then every third week, I'm on call.
Great, thank you. That sounds like a very intense and busy schedule to me, like going over all the and then taking care of all the patients. I think that's all the questions I have. Does our attendees have any more questions for our panelists? Thank you. Thank you all for giving us this great panel. I think I personally I learned a lot from attending this. Yeah. Thank you for sharing your experience with us. Thank you.
Thank you, Yushin, for putting this all together for us. I know that you have been amazing at all of this. So thank you for hosting us today. And thank you to UC Davis for hosting us today.
Thank you. I know who to call in New England, Arizona now. So thank you guys. Good to meet you guys virtually.
Thank you. Nice to meet
And
you.
thank you to our panel as well. I appreciate it.
Thank you.
And Liz, where are you from again?
I'm from Wisconsin.
Wisconsin. All right, cool. I got friends there now too. Awesome.
Oh,
Bye,
yep. You betcha.
All right. Everybody,
Of
Bye.
course.
Thank you.
Take care, everyone.